Hi, I'm John Steenhuisen, leader of the Democratic Alliance, and I'm standing in front of the Hospital of Hope at the Cape Town International Convention Centre, Africa's largest dedicated COVID-19 hospital launched by the Western Cape government. The Hospital of Hope is just one of a series of dedicated field hospitals across the province, including the Tusong Hospital in Khayelitsha, the Brackengate Intermediate Care Facility in Brackenfell, and the Sonstraal facility in Paarl. The Western Cape government has bought 41 public and privately owned quarantine and isolation facilities online, providing a total of 4,766 beds, with additional sites identified and activated to immediately create more bed space should it be needed. The province has also recruited over 400 temporary healthcare workers with a database of over 2,000 volunteers. It has completed 19 temporary testing and triage centres at hospitals across the province, with a further 16 underway. It has also implemented high-flow nasal oxygen at Groote Schuur and Tygerberg hospitals for serious COVID cases. And of the 15th of July, the Western Cape has conducted 360,135 tests. We now know that active cases in the Western Cape have fallen by 14% since they reached their peak on the 6th of July. And 78% of people diagnosed with COVID in the Western Cape have recovered. This compared with 48% nationally. The Western Cape has conservatively budgeted to spend about 5 billion rand this financial year on its health response, which is already yielding results. Now, this is not to say that the pandemic in the province is over, nor that there won't be another spike in infections. But the state of readiness in this province is proof of three key things. One, that in the hands of a capable state and with decisive and effective leadership, South Africa's lockdown could have been used to effectively pool resources and allocate funding to prepare an effective coronavirus response. Secondly, that through aggressive testing, tracing and quarantining and intensive public-private partnerships, the transmission of COVID-19 can be limited and it can be prevented. And thirdly, that when turnaround plans coupled with an effective treatment strategy are put into place, South Africa can save lives while also saving livelihoods in an open and fully functioning economy. Our lockdown has ballooned from 3 weeks to over 3 months. Millions of South Africans have lost their jobs, businesses have closed down, and our economy is collapsing. National government has done very, very little to justify the devastating losses endured by the people of South Africa under one of the hardest lockdowns in the world. But there is a way out. The DA has put together a sensible and actionable plan for an incapable state, which is available on our website. And I'd like to go through some of our recommendations with you. Firstly, it is estimated that South Africa loses 16 billion rand every day under lockdown. This costs around 304 billion rand in lost tax revenue alone. The Western Cape's response for the entire year costs a fraction of this at around 5 billion rand. If national government urgently replicated the systems put into place in the Western Cape, South Africa would only need to spend an estimated 50 to 60 billion rand for the year on an effective coronavirus response that will contain the virus and allow our economy to open. That is how you save both lives and livelihoods. Secondly, South Africa must aggressively ramp up testing, tracing and treatment. National prevention and treatment capacity has completely collapsed. The public sector is now only conducting 13,000 tests per day, which is well below the target of 36,000. And on our current trajectory, 5 out of every 6 citizens requiring hospital treatment may end up being turned away. Private sector testing needs to be brought into a unified strategy to bolster and support the public sector if we're going to test and trace effectively. Thirdly, funding must not be a limiting factor in this equation. Government needs to urgently reprioritise its spending of taxpayer money. When government can approve a 16.4 billion bailout for South African Airways, but cannot build field hospitals with oxygenated beds in coronavirus hotspots, as we're seeing in Gauteng and the Eastern Cape, it is essentially spending public money on a business class seat instead of a hospital bed for a desperately sick South African. We absolutely cannot and must not accept this. The Democratic Alliance and our governments remain absolutely open and cooperative with national government to share our expertise and best practice with the rest of the country in the interests of the lives and livelihoods of all South Africans. But South Africa is at the mercy of the incapable state, which has now blamed the citizens for its failure to utilize the lockdown to prepare an effective coronavirus response. We also have a lack of leadership and political dithering, as well as contempt for the private sector, as the obscene misspending of taxpayers' money has paralyzed the state at exactly the time when vulnerable South Africans need it the most. For more information on the action plan, please visit our website. We need to work together to turn the tide of the coronavirus, and let's save South Africa together.